Welcome to Doc Talk, where we're talking about the questions patients are asking. Hi, I'm Dr. Julia Redding, and I'm a board-certified pediatrician. Let's talk about vomiting and diarrhea. I think vomiting and diarrhea can feel really scary as a parent because you see your child looking really sick and losing all this volume and fluid. And the main thing is keeping the fluid inside the body, which can feel hard to do. And in general, we don't really do antibiotics anymore. I think in other countries or in the olden days, we did more antibiotics. I think in adult medicine, they do it a little more, but with kids, we really focus on staying hydrated. The vomiting, I think, tends to be the scariest part, but the good news is vomiting usually only lasts like 1 to 2 days. And if your child cannot keep anything down, that's when I would come see your doctor, me, and we can prescribe an anti-nausea medicine, and usually kids just need 1 or 2, and then the vomiting subsides and they're able to keep fluid down. So I tell people, as long as you're peeing 3 or 4 times a day, you have enough fluid inside of you to stay healthy and okay. But that can be hard to keep track of if you're running to the bathroom every hour with diarrhea and stuff like that. But I try and tell people to just check that, and that's the most important thing. If you notice the mouth is getting really dry, there's no tears, then that might start to be signs that we're losing a little too much fluid. But once the vomiting subsides, people are usually able to keep their fluid in their body pretty well. And then the question is, what do you do with the diarrhea? Because the anti-nausea medicine is just the vomiting. And so we say try and limit juice, right? We want you to have liquids. So we want you to have Pedialyte or Gatorade that's sugar-free, potentially, chicken broth, vegetable broth, anything with electrolytes to stay hydrated. And then we want to limit dairy, greasy food, stuff that's going to upset the stomach. And sometimes kids have to kind of limit how much food they're eating because it just triggers the diarrhea in the first few days. With the vomiting, we also want to make sure we're taking small sips because we get so thirsty, and then we finally get our nausea medicine and we're feeling better, and then the kid chugs a big glass of water and they throw it right up. And so it can be really hard, but you just start with little sips and work your way up. And then similar with the food and the diarrhea, you might not be able to tolerate much food because then it just triggers you to keep having diarrhea. So it's really just about managing that fluid that you're trying to keep in your body and letting your body just heal itself from there. I think an infant, we worry a little more that they might have trouble. We worry that under a year, an infant is a little more fragile, right? So they might have a little more trouble if they're having a lot of vomiting and diarrhea, staying hydrated. But in my experience, what happens is the baby still takes milk very well. And so that's when it really just becomes about counting how often they're peeing, making sure they don't look too dry in their face, in their mouth, in their eyes. And as long as that is staying okay, then, you can, even if it feels scary, there's so much diarrhea, you can feel a little reassured that they are still maintaining a good amount of volume. If a baby is refusing fluids, looks really dry, or even an older kid, then they might have to go to the ER, urgent care for fluids. And that would be IV fluids. But the good thing is too, I feel like when I've seen kids needing IV fluids, once they get that fluid in themselves, they feel so much better. And moving forward, they end up having an easier time and they're able to go home. So sometimes they just need that little boost, like a little tune-up. But it's very rare that I even see someone needing IV fluids. Even as an infant, it's just we have to be a little more careful because they are a little more fragile, right? They're smaller and younger, and so we just watch them closely. For Doc Talk, I'm Dr. Julia Redding. Here's to your health.